Senator, you have not yet explained how you would protect people with pre-existing conditions or laid out that plan.
Well, look, we currently have laws and regulations in place right now that protect people with pre-existing conditions. We want to keep those regulations in place, but we also want to make the health insurance marketplace function a little bit better. Now, what Governor Walz just said is actually not true. A lot of what happened and the reason that Obamacare was crushing under its own weight is that a lot of young and healthy people were leaving the exchanges. Donald Trump actually helped address that problem, and he did so in a way that preserved people's access to coverage who had pre-existing conditions. But again, something that these guys do is they make a lot of claims about if Donald Trump becomes president, all of these terrible consequences are going to ensue. But in reality, Donald Trump was president. Inflation was low. Take-home pay was higher. And he saved the very program from a Democratic administration that was collapsing and would have collapsed absent his leadership. He did his job, which is govern in a bipartisan way and get results, not just complain about problems, but actually solve them.
Governor, did enrollment under the Affordable Care Act go up under the Trump administration?
It's higher now that we've seen it go up. Look, people are using it. The system works. And the question about this of young people or whatever, that's the individual mandate piece of this. And Republicans fought tooth and nail saying, well, Americans should be free to do this. Well, then what happens is—
So you think the individual mandate's a good idea?
You shrink. I think the idea of making sure the risk pool is broad enough to cover everyone, that's the only way insurance works. When it doesn't, it collapses. You are asking pre-ACA where we get people out. Look, people know that they need to be on health care. People expect it to be there. And when we are able to make it, and we are making it this way, when we incentivize people to be in the market, when we help people who might not be able to afford it get there, and we make sure then when you get sick and old, it's there for you. Because I heard people say, well, I don't want to buy into Medicare or whatever. Good luck buying health care once you get past 70. So look, the ACA works. We can continue to do better. Kamala Harris did that. The way she made everything better was negotiating those 10 drugs on Medicare for the first time in American history.
Thank you. Margaret?